What if everything you've been told about high blood pressure is only half the story? What if the biggest threat to your heart isn't salt, stress, or aging, but something invisible, untested, unmeasured, yet silently driving your blood pressure into dangerous territory? Today, we're going deeper than ever before into the hidden triggers doctors rarely talk about that could be wrecking your cardiovascular health right now. You already know high blood pressure is dangerous, but how dangerous? Unchecked hypertension doesn't just strain your heart, it can lead to heart attack, stroke, kidney disease, vision loss, and even cognitive decline. That's right, the silent killer is far more ruthless than most people realize. But the shocking part? Even if you eat right, exercise, take your meds, and visit your doctor regularly, your blood pressure can still be high because most seniors are missing the real causes that matter most. Those triggers hide in the shadows of everyday life, and watching this video could literally change how your body functions every day. Why you must watch all the way through. Because each trigger we uncover reveals a piece of a puzzle most experts don't discuss, and ignoring even one could keep your blood pressure dangerously elevated. What you think causes high blood pressure versus the truth. Part 1. The hidden heart danger you've never been told about. Most folks assume aging, salt, or stress are the biggest drivers of hypertension. That isn't wrong, but it's incomplete. In reality, doctors categorize high blood pressure into two main forms: primary hypertension, the kind most older adults develop over time, often with no single identifiable cause, and secondary hypertension, high blood pressure that's triggered by a hidden condition or overlooked factor. And what most people don't realize, many hidden triggers are not part of a routine checkup, and they won't show up unless you or your doctor specifically look for them. So let's start at the beginning. The first hidden trigger: sleep, or the lack of it. You might think sleep is for rest. You'd be wrong. Your heart actually repairs itself while you sleep. Your blood pressure dips, your stress hormones go down, and your cardiovascular system gets a chance to recover. But the kicker? If your sleep is disrupted, especially because of undiagnosed sleep apnea, your blood pressure never gets that break, and it never drops. Sleep apnea is a condition where your airway repeatedly closes while you sleep. Your brain wakes up just enough to gasp for air, which triggers a fight or flight stress response over and over again throughout the night. Every time your oxygen drops, your heart rate jumps, your blood vessels tighten, and your blood pressure spikes. And most people don't even wake up fully, so they never realize it's happening. But the real twist? This hidden trigger doesn't just affect sleep quality, it keeps your blood pressure elevated all day long, no matter what diet you follow or how much you exercise. So before you blame diet or medication alone, ask yourself, how well are you actually sleeping? Could your nights be sabotaging your days? Because if your sleep is broken, your heart never truly gets a break. 2. Why your blood pressure rises while you think you're resting. What if the most dangerous hours for your heart aren't when you're awake, but when you're asleep and completely unaware? The uncomfortable truth most seniors never hear. High blood pressure doesn't rest at night unless your body is able to rest. And for millions of people over 60, that never happens. When healthy sleep occurs, blood pressure naturally drops by 10 to 20%. Doctors call this nocturnal dipping, and it's a sign your heart is recovering the way it should. But in people with poor sleep quality or sleep apnea, that dip never happens. In some cases, blood pressure actually rises overnight instead. This pattern is strongly linked to higher risks of heart attack and stroke. Sleep apnea is one of the most powerful drivers of this problem. During apnea episodes, oxygen levels fall, stress hormones surge, and your nervous system switches into survival mode. Your body doesn't know you're safe in bed. It thinks you're in danger. Night after night, this conditions your heart and blood vessels to stay tense around the clock. That's why experts at Harvard Medical School and the American Heart Association consistently link untreated sleep apnea with resistant hypertension, blood pressure that stays high even with medication. And where it gets even more dangerous, many seniors assume symptoms like daytime fatigue
Memory fog or morning headaches are just part of aging. They're not. These are classic warning signs that your brain and heart aren't getting enough oxygen at night. Loud snoring, waking with a dry mouth, or needing frequent naps are other red flags doctors look for. The good news? This trigger is treatable. A simple sleep study, often done at home, can identify apnea. Treatments like CPAP therapy have been shown to significantly lower blood pressure, improve energy, and reduce cardiovascular strain within weeks. Even modest lifestyle changes help. Losing as little as 5 to 10% of body weight can reduce apnea severity and improve blood pressure. Keeping consistent sleep schedules, avoiding late-night meals, and limiting screen exposure before bed all support healthier nighttime blood pressure patterns. But sleep is only the beginning, because there's another hidden trigger that raises blood pressure even when you're awake, eating well, and taking your medication perfectly. It doesn't show up on blood tests, it doesn't hurt, and doctors rarely ask about it. Yet research shows it can quietly raise systolic blood pressure year after year, especially in older adults, and it has nothing to do with food, exercise, or sleep. It has everything to do with who or what is missing from your daily life. 3. The silent blood pressure assassin: loneliness and isolation. You follow your diet, you walk every day, you take your meds on time, then still your blood pressure won't budge. What if the reason isn't in your body, but in your world? It sounds emotional, not medical, but the research says otherwise. Studies of middle-aged and older adults show that social isolation and loneliness are linked with higher blood pressure and greater cardiovascular risk, even when other lifestyle factors are controlled for. In one long-term study, people who felt lonelier had significantly higher systolic blood pressure over time, with the effect compounding year after year. That means loneliness isn't just sadness, it's biologically stressful. What happens inside your body? Your brain senses a lack of social connection. It activates stress response systems, the same ones triggered by danger. Stress hormones rise, blood vessels tighten, blood pressure climbs day after day. That's not conjecture. It's backed by multiple longitudinal studies showing loneliness correlates with higher blood pressure and cardiovascular strain over time. Notably, research also highlights social isolation itself, not just the feeling of loneliness, as strongly associated with hypertension risk in older adults. This means that simply being alone frequently, even without feeling isolated, can raise blood pressure. And the risks extend beyond heart health. Isolation and loneliness are linked to higher overall mortality in older adults. They're associated with weakened immune function and inflammation, and they contribute to a cascade of stress responses that make your body act as if it's under constant threat. The twist most people don't hear in the doctor's office: you can't measure social stress with a blood test, but your arteries feel it, and the influence is real. Think about it. You might be physically healthy, eating well and exercising, but if you spend most of your day isolated, your heart could be under more stress than you realize. That's because your cardiovascular system doesn't just respond to food and exercise, it responds to connection or the absence of it. And that leads us to a powerful question. Who do you connect with regularly? How often do you laugh with someone? When was the last time you felt truly seen, not just heard? Because these aren't just feelings, they have direct impacts on your heart and blood pressure trends. But in the next part, we'll reveal something even more unexpected, a daily habit many over 60s assume is harmless, yet it can trigger blood pressure spikes every single day without them even knowing. 4. The daily habit that quietly spikes your blood pressure. What if one of the most dangerous blood pressure triggers isn't rare, isn't dramatic, and isn't discussed in the doctor's office because it feels completely normal? For millions of seniors, this trigger happens every single day. It feels harmless, routine, even responsible. Yet research shows it can push blood pressure higher, especially in people over 60.
Hidden Trigger 3: Common Medications and Helpful Supplements. A hard truth: some of the very pills meant to help you feel better can quietly raise your blood pressure. And most people never make the connection. According to the American Heart Association, several widely used medications are known to elevate blood pressure, especially in older adults who are more sensitive to their effects. These include certain pain relievers, especially NSAIDs like ibuprofen and naproxen, decongestants found in cold and flu medicines, some antidepressants, steroid medications, even certain eye drops used for glaucoma. NSAIDs are particularly concerning. The Mayo Clinic explains that they can cause the body to retain sodium and fluid, narrowing blood vessels and increasing blood pressure, sometimes significantly. Many seniors take these drugs daily for arthritis, joint pain, or headaches, assuming they're safe because they're over-the-counter. But over-the-counter does not mean risk-free. The supplement trap. Now where it gets even more unexpected. Certain herbal supplements marketed for energy, mood, or immunity can also raise blood pressure. The Mayo Clinic and National Institutes of Health warn that supplements like licorice root, ginseng, ephedra, bitter orange can interfere with blood pressure control and even reduce the effectiveness of hypertension medications. The danger? Many people never tell their doctor about supplements because they don't see them as real medicine, but their cardiovascular system does. Why this hits seniors harder. As we age, our kidneys and blood vessels become less adaptable. That means the same medication dose that barely affected you at 45 can push your blood pressure up at 65. The American Geriatric Society notes that older adults are especially vulnerable to medication-related blood pressure changes due to slower metabolism and drug interactions. So what should you do? Not panic, but pay attention. Review every medication and supplement with your doctor or pharmacist. Ask directly, could this affect my blood pressure? Never assume natural means safe. Because sometimes the thing quietly driving your numbers up isn't your diet. It's in your medicine cabinet. And in the next part, we'll uncover a trigger that doesn't come from pills, sleep, or loneliness, but from something deeply tied to how your body keeps time. And once you understand it, you'll never look at your daily routine the same way again. 5. When your body clock turns against your blood pressure. What if your blood pressure isn't just reacting to what you eat or how you sleep, but to when you do everything? This is one of the most ignored triggers in seniors because it doesn't feel like a health problem. It feels like a routine. Hidden trigger 4. Disrupted circadian rhythm and irregular daily patterns. Your body runs on an internal clock known as the circadian rhythm. This clock controls when you feel alert, when hormones are released, when blood pressure rises, and when it's supposed to fall. In healthy adults, blood pressure follows a predictable daily rhythm, higher during the day, lower at night, a gentle rise in the morning to prepare the body for activity. But research shows that irregular schedules can disrupt this rhythm and keep blood pressure elevated throughout the day and night. For many seniors, this disruption happens slowly. You wake up at different times, meals are irregular, you nap at random hours, you stay up late watching TV, then sleep in the next day. It feels harmless, but your cardiovascular system notices. What science shows. Harvard Medical School researchers explained that circadian rhythm disruption increases stress hormone release, raises heart rate, and interferes with normal blood pressure dipping at night. Over time, this contributes to sustained hypertension. The American Heart Association also reports that people with inconsistent sleep and daily routines have higher risks of hypertension, heart disease, and stroke, even when total sleep time seems adequate. In older adults, this effect is stronger. Why? Because aging already weakens circadian signals. When routines become inconsistent, the internal clock struggles to regulate blood pressure properly, leading to higher baseline readings throughout the day. Why this often goes undetected. Doctors rarely ask about timing. They ask what you eat, not when. They ask how much you sleep, not how consistent it is. So this trigger quietly does its damage year after year. But the encouraging part, how to protect your heart clock. Simple consistency can make a measurable difference. Wake up and go to bed at the same time daily. Eat meals at regular hours. Get morning sunlight exposure. Avoid late-night screens and heavy meals. Studies show that stabilizing daily rhythms can help lower blood pressure and improve overall cardiovascular regulation even without medication changes. Your heart doesn't just need healthy choices, it needs predictable signals. And now, there's only one final hidden trigger left. It's the one most seniors never suspect, because it often comes from something doctors recommend. And once you hear it, you may rethink one of the most common healthy habits altogether. 6. The healthy habit that can backfire after 60. What if something doctors encourage, something you may already be doing to protect your heart, is actually pushing your blood pressure higher because of how it's done? This isn't about quitting a healthy habit, it's about doing it the right way, especially after 60. Hidden trigger 5. Exercising the wrong way for your age and condition. Exercise is one of the strongest tools for lowering blood pressure. That's well established. Regular physical activity can reduce systolic blood pressure by 5 to 8 mmHg in people with hypertension, but the part most seniors are never told. Certain exercise patterns can temporarily spike blood pressure to dangerous levels, and if repeated incorrectly, they can keep baseline numbers elevated. The Mayo Clinic explains that intense exertion, breath holding, and sudden bursts of effort can cause sharp blood pressure rises, particularly in older adults or those with existing hypertension. This includes lifting heavy weights while holding your breath, sudden high-intensity workouts without proper conditioning, pushing through dizziness or chest tightness, exercising aggressively when dehydrated or overheated. Many seniors believe if some exercise is good, more must be better. That assumption can backfire. Why this happens? As we age, blood vessels stiffen naturally. During intense or poorly paced exercise, the heart must pump harder against that stiffness, driving blood pressure sharply upward. In some cases, systolic pressure can exceed safe ranges during exertion. Harvard Health notes that while exercise is protective long-term, improper intensity and breath control increase cardiovascular strain, particularly in people over 60 or those on blood pressure medications. The safer, smarter approach. You don't need extreme workouts to protect your heart. The American Heart Association recommends moderate-intensity aerobic activity, light to moderate resistance training with controlled breathing, avoiding breath holding, and gradual warm-ups and cool-downs. These approaches consistently improve blood pressure without risky spikes. The goal isn't intensity, it's consistency and control. Why this trigger is often missed. Doctors ask if you exercise, not how. Patients say yes, and everyone assumes the habit is helping. But if exercise is done incorrectly, it can become another hidden stressor on the cardiovascular system, especially when combined with medications, dehydration, or fatigue. And now we've revealed all 5 hidden triggers, but knowing them isn't enough. In the next part, we're going to connect the dots, showing how these triggers stack together, why they're so dangerous when combined, and how small changes can produce surprisingly powerful improvements in blood pressure. This is where everything comes together. 7. Why these triggers are so dangerous when they stack together. What if the real danger isn't one hidden trigger, but how several of them quietly combine to overwhelm your heart? This is where most seniors get blindsided. Each trigger we've uncovered, poor sleep, loneliness, medications, disrupted routines, and improper exercise, is risky on its own. But together, they don't just add up, they multiply. The compounding effect most people never consider. Cardiologists have long known that cardiovascular risk is cumulative. When multiple stressors act on the body at the same time, blood pressure regulation becomes significantly harder, even with medication.
The American Heart Association confirms that overlapping lifestyle, psychological, and physiological stressors dramatically increase hypertension severity and cardiovascular events. What that looks like in real life? Poor sleep raises nighttime blood pressure. Loneliness keeps stress hormones elevated during the day. Certain medications blunt your body's ability to regulate fluid and vessel tone. Irregular routines confuse your internal clock. Improper exercise adds sudden pressure spikes. Your heart never gets a true recovery window.
Harvard Medical School explains that chronic activation of the stress response system leads to sustained vascular constriction, inflammation, and impaired blood pressure control, a pathway strongly linked to heart attack and stroke risk in older adults. Why medications alone often aren't enough. Many seniors feel frustrated when their blood pressure remains high despite increasing medications. This isn't failure, it's physiology. Research shows that when underlying behavioral and environmental triggers aren't addressed, medication effectiveness is reduced, leading to what clinicians call treatment-resistant hypertension. In other words, you can't out-medicate a system under constant hidden stress. That's why leading guidelines now emphasize whole system management, sleep, social health, daily rhythms, movement, and medication review, not pills alone. The encouraging truth, the part that should give you hope. Studies consistently show that addressing even 2 or 3 of these hidden triggers can lead to meaningful blood pressure reductions, sometimes comparable to adding another medication, especially in adults over 60. Small changes, big physiological impact. But that leads to an important question. Where should you start? Which changes matter most? And how do you take control without feeling overwhelmed? In the next part, we'll break this down into a clear, practical plan, step by step, so you know exactly what to focus on first to protect your heart. This is where awareness turns into action. 8. The simple action plan that puts you back in control. What if lowering your blood pressure didn't require more pills, but better priorities? The mistake most seniors make after learning all this. They try to fix everything at once. That leads to stress, confusion, and giving up. Instead, heart experts recommend a layered approach, tackling the highest impact triggers first in the simplest way possible. Let's break it down. Step 1. Fix the one thing that controls everything: sleep. If sleep is broken, nothing else works properly. The American Heart Association and Mayo Clinic both identify sleep quality as a foundational factor in blood pressure regulation, especially in adults over 60. Poor sleep keeps stress hormones elevated and prevents normal nighttime blood pressure dipping. Action. Aim for consistent bed and wake times. Talk to your doctor about snoring, fatigue, or morning headaches. Ask directly about sleep apnea testing. This single step alone has been shown to improve blood pressure control in many seniors. Step 2. Review what you take, not just what you eat. Medication-related blood pressure increases are widely documented but often overlooked. The American Heart Association lists common drugs and supplements that raise blood pressure, including NSAIDs and decongestants. Action. Make a complete list of medications and supplements. Review them with a doctor or pharmacist. Never assume over-the-counter means harmless. This step alone has helped many seniors regain control without increasing prescriptions. Step 3. Stabilize your daily rhythm. Harvard Medical School explains that irregular routines disrupt circadian control of blood pressure, increasing cardiovascular strain. Action. Eat meals at consistent times. Get morning sunlight. Avoid late-night screens and heavy meals. Your heart thrives on predictability. Step 4. Move, but the right way. Exercise lowers blood pressure, but intensity matters more with age. The Mayo Clinic and Harvard Health both stress moderate, controlled activity for seniors with hypertension. Action. Walk regularly. Breathe continuously during movement. Avoid sudden strain or breath holding. Step 5. Reconnect, because your heart notices. Loneliness is now recognized as a cardiovascular risk factor. Large studies published in peer-reviewed medical journals show social isolation is associated with higher blood pressure and increased heart disease risk in older adults. Action. Regular conversations, group activities, purposeful social contact. This isn't emotional advice, it's heart protection. One final thought. You don't need perfection, you need direction. And in the final part, we'll bring everything together, revealing how seniors who apply even half of this plan often see meaningful improvements, and how to know if your blood pressure is finally moving in the right direction. 9. How to tell if your blood pressure is finally turning the corner. What if your blood pressure isn't stubborn? What if it's been waiting for the right signals all along?
This is the moment most seniors miss. They make changes, but they don't know what progress actually looks like, so they assume nothing is working. In reality, the body often improves before the numbers fully catch up. Let's talk about how real improvement shows up, according to medical research. Blood pressure improvement is a process, not a switch. The American Heart Association explains that when lifestyle and behavioral triggers are corrected, blood pressure often improves in stages, not overnight. What doctors commonly see first? Better sleep depth, fewer morning headaches, less afternoon fatigue, more stable energy, fewer sudden pressure spikes. These are early signs that your nervous system is calming, which is essential for long-term blood pressure control. Harvard Medical School notes that improvements in sleep, stress regulation, and daily rhythm often reduce sympathetic nervous system activity before major blood pressure drops appear on a monitor. Why home readings matter more than one doctor visit? Many seniors feel discouraged after one high reading at the clinic, but the Mayo Clinic emphasizes that home blood pressure monitoring gives a more accurate picture of cardiovascular health over time, especially in older adults. What to watch for? Lower average readings over 2 to 4 weeks, fewer extreme highs, better morning numbers, more consistent day-to-day results. Even a reduction of 5 millimeters of mercury in systolic pressure significantly lowers the risk of stroke and heart disease. That's not a small win, that's a life-changing shift. The biggest mistake to avoid: giving up too early. Research shows that seniors who maintain consistent sleep routines, social engagement, medication reviews, and moderate exercise often see measurable blood pressure improvements within 8 to 12 weeks. The body needs time to relearn safety. Remember, your heart has spent years adapting to stress. It won't unwind in days, but it will respond to consistency. A quiet but powerful reframe. High blood pressure isn't always a sign your body is failing. Often, it's a sign your body has been overprotecting you for too long. When you remove the hidden threats, the heart finally stands down. And that leads us to the final part, where everything comes together into one clear takeaway and one question every senior should ask their doctor after watching this video. This is where understanding becomes empowerment. 10. The one question that can change your blood pressure journey. What if one simple question, asked at the right time, could uncover what years of checkups have missed? Most seniors leave the doctor's office with a prescription, but without clarity. And clarity is where real change begins. The question every senior should ask: after everything you learned so far, the most powerful question you can bring to your next appointment: could something outside of my diet and medication be keeping my blood pressure high? This question matters more than it seems. Why? Because clinical guidelines from the American Heart Association now emphasize that hypertension management must go beyond medication alone, especially in older adults. When doctors are prompted to look deeper, they're more likely to evaluate sleep quality and sleep apnea risk, medication and supplement interactions, daily routine consistency, stress and social factors, exercise type and intensity. These factors are often not fully explored unless the patient brings them up. Why this shifts the conversation? Instead of just adjusting doses, this question reframes high blood pressure as a system issue, not a single number problem. Harvard Medical School explains that when physicians address contributing lifestyle and behavioral triggers, patients often experience better blood pressure control and fewer medication side effects. This doesn't replace medication, it makes medication work better. A pattern seen again and again. Across large observational studies, seniors who actively engage in their care, asking informed questions and addressing hidden risk factors, show better long-term cardiovascular outcomes. That's not coincidence, that's empowerment.
and empowerment changes physiology. Why you're not too late? Many people believe high blood pressure after 60 is inevitable. It isn't. Research consistently shows that meaningful blood pressure improvements are possible at any age when underlying contributors are addressed.